My name is Doreen Nicholas, the Domestic Violence Response Manager here at the Coalition.
My name is Samantha Hinchy. I'm one of the Domestic Violence Response Coordinators.
Hi everyone, good morning. My name is Ruby and I'm one of the also Domestic Violence Response Coordinators here.
Okay, so we put this discussion together because, morning Lindsay.
Hi.
Because we wanted to talk about some safety planning approaches and talk about some of the challenges you all might be having when survivors reach out to you. Marianne, did you get your sound back? Let us know. So between the Sexual Violence Response Department and the Domestic Violence Response Department, we've been working furiously to get some tools out to you all to help you during this time. I don't think I need to say that the way we do our work is changing. So we have been in contact with programs and coalitions across the country, listening to their feedback and some of the things that they're doing. And we put together a guide to safety planning, and we're going to bring it up on the screen here. We'll review it, and we'll make sure to get it sent out to you. We've sent it out last week, right? We sent it out last week. We want to make sure it's in all the advocates' hands. And yay, Gabriella, she can hear us and see us. Wonderful. So we want to make sure it's in everybody's hands. So we'll be sending this out along with a self-care toolkit and a creative outreach toolkit that the Sexual Violence Response Department put together. But we wanted to take the time to review this tool, talk about challenges you guys might be having, and see if we can problem solve. So as we've done for much of the movements to end sexual and domestic violence, we've had to adapt when things change in our communities. So this is one of those occasions. So when we talk about safety planning, what are some of the challenges right off the top of your head that you guys are facing? Use the chat box over there. What are some of the challenges? Physically helping victims, right? Physically seeing kids.
So Anna saying being able to speak to a survivor in private on both your end and theirs. It's true. So limiting people in our spaces, especially like clinics and things like that. Survivors not having smartphones. So that's become a barrier for mobile advocates. Distancing ourselves from others, especially the kiddos.
No place safe to go. Shelters aren't taking anyone. One of the things we talked about on Friday being that if there is a shelter, sometimes they may have been able to accommodate 2 or 3 families to a room, and now because of social distancing, etc., they have been having just 1 family a room, so it's cut down on shelter space. We talked a little bit about people reaching out to the local hotels and motels, because I'm sure their business is down, and in conjunction with your funders, seeing if you can free up funds to get hotel or motel rooms. So think about that in your community. Yes, working from home, Noemi, trying your best to see clients at the courthouse. Victim services isn't active anymore. So we'll have to be those victim advocates too, to the best of our ability, right? I'm sure it's been very difficult, Gabriella. So let's talk about some of these safety approaches and how to do that different. So we're going to put that flyer back on the screen, the guide that we put together. So we certainly know that a lot of victims and survivors might be isolated at home. In the cases of sexual assault, they might be living in the same complex as the person that assaulted them, if they're living in an apartment. If they're still working and there's harassment at work, that might be still going on. We've heard all kinds of reports from across the country on how abusers are using this COVID virus to threaten their partners, to not allow them to leave the house and go to work or go any place like shopping. As abusers do, they'll use the situation to their advantage. And in this case, it's to further isolate survivors and cut them off from any kind of social support, whether it's friends, family, or us. So I'm sure that dynamic is very clear to everyone. So if you do get lucky enough to connect with a survivor who's still at home with their abusive partner, we need to brainstorm with them on how they can go to a safe place in their house, or going into the bathroom or the closet. If they're on the phone and they're away from their abusive partner at the other end of the house or in the bathroom, they can run the shower or the faucet to make some noise during the call. We shared, I think last Friday or at some point last week, it's kind of a blur, that one of our advocates on the helpline got a call from a woman who was whispering. So, you know, for sure she was probably around her abusive partner or somebody that wasn't safe. And she called the helpline whispering to get some information. So this brings that dynamic to the forefront, that when we take these calls, we have to listen very deeply. We have to listen to what's being said and what's not being said. One of the examples from the past couple of years was this woman called 911, but her partner thought she was calling a pizza place. And when the 911 operator answered, she started ordering a pizza. And the 911 operator said, "This is not a pizza place, this is 911. And on her end, she goes, "Yes, I know, and I would like," and she continued on with her order. And the 911 operator picked up on that and said, "You can't talk, can you?" And she said, "That's right. And then I would like," and the 911 operator said something along the lines, are you in danger? And she answered in the affirmative, you know, but pizza related. And he dispatched law enforcement to her house. So it's really important that we listen deeply on these calls. You may well get calls like that. Some survivors may have some respite during the day when their partner's at work, and they might reach out to you during that time. But you can tell them about the helpline. You can tell them about the resources you're able to provide. But some of those calls might be quiet and they might be quick and they might sound weird at first, but again, it's survivors being creative on how they can reach out for help. If people are able to go outside, like take their kids for a walk, you know, that might be those moments when they have a chance to call you. There are people still out there. We need to get that information out in our communities that we're still available. We're still providing services. We're trying to keep updates on our website on the changes in services for people or helpers to refer to. It's really important that if they have a chance, and these are all tips you can give to folks when they call too. So they might want to create a code word or a certain phrase or sentence with a family member or friend that lets them know that they need help or immediate assistance. So talking about that, if it gets to this point, I'm going to say X, Y, and Z, and that means I need help, and ask that survivor, what kind of help that they need. Not everyone will want you to call the police or 911. It might be that you interrupt what's going on by coming over and dropping off toilet paper. But you may well get calls from people that know somebody that's being mistreated and needs some help and support, and they want to know what to do. So you could give them these suggestions. Just like any other situation, if a survivor does get to you and they are planning on leaving, and think they have the ability to do that, we want to talk about making sure they have their ID secured someplace, a go bag of things like their medication, money, phone charger, food, identification, whatever they're able to get and whatever they're going to be in need of once they do leave. And again, you know, what's the easiest and safest routes for them to get out of their home quickly and get to help. I'll scroll down. We know that there's no perfect plan of safety, and especially right now, there are many more barriers, and we just need to anticipate that and be aware of that. So when we do have the opportunity to talk to survivors, we can give them some ideas, help them be creative about their environment and their support network. Some of them might be lucky enough to still be working, and that might be the time and place where they implement safety measures and outreach. So hopefully you get some ideas from this guide that you can use with the folks. So some other things that we've talked about is technology, safety with technology. And we want to enhance their security. We know that some partners insist on being able to access a survivor's electronics. If they are looking for help on their phone or their laptop or whatever device they have, it's really important that we walk them through how to clear their browser history, to clear any recent calls, to make sure they delete text messages, delete emails, try to find a different phone number that they can use. On Google Voice, you can get another phone number. There are safety planning apps or other resources like My Plan that ASU put out. And then the location sharing settings on their cell phone. That's an important thing to turn off, especially if they do leave or they're going someplace that they don't want their partner to know, like you know, to meet you at the court or to go to a coffee shop to talk to an advocate, whatever the location is that they don't want their partner to know. And being familiar with those on your own phone so you can walk somebody through that process is really important. Googling Google Voice And the My Plan app, so you're familiar with it and can walk them through it, is always a good way to prepare for those calls and having that technology safety conversation with the survivors that you're working with. Anything to add to that section?
No, just make sure, just one thing, just make sure that when you are looking at location sharing settings and stuff that you're doing, there's 2 locations. You just want to make sure that you're turning off the location that's on their phone, like just their regular phone when they get it. And then if they have any apps like Facebook, Snapchat, Instagram, anything that you can upload photos, those also need to have location like privacy settings taken care of. Because those, anytime that they upload a photo onto their social media, that the location is tagged, but you can take that location tagging off. And so we just want to make sure that people are doing it for both their phone and their social media.
So if you're not familiar with that kind of stuff, that would be a little bit of homework that you guys can do, is look at geotags, location settings, those kind of things. So again, you can walk them comfortably through that as they're making a plan. It's really important too, if we do have a chance to talk to survivors, and you know, if they make it to us and then we get that phone call, that's an opportunity that we don't want to waste. So help them think about their daily routines. If their partner again is working, or the survivor is working, we can give them some ideas again on when and how to reach out for help or leave. If they go into the laundry room doing laundry, or they go outside the home to a laundromat, that might be an opportunity. Like we mentioned before, going for a walk or walking their dog. If the parks are still open, they take their kids to the park, that might be an opportunity. Grocery shopping, getting water. And again, this was part of the discussion with the outreach, the creative outreach is to reach out to those places that people are still able to go to, and talking with the staff, with the manager there, and giving them some of your cards or some of your brochures, that if somebody in need does approach them, they've got something to give that survivor. Taking the trash out might be an opportunity for a quick call. Make calls to their family or their supervisor, that outreach for assistance or to let them know what's going on. Exercising, getting gas, washing the car. Any of those might be opportunities for them to have a few minutes to reach out to us. Going to a convenience store, some folks, if they don't have transportation and there's a local convenience store, that might be the only place they have to reach out for help. So, you know, that's one of the ways that we can get out in the community, like I said, is to reach out to those businesses that are still open. Introduce yourself, tell them what program you work for, tell them, you know, give them short, in a nutshell, what some people experiencing domestic or sexual violence might be going through, and you might be reached out to for help. And if so, the expectation isn't that they, you know, do everything that the survivor needs, but they give them information and they can reach out to the local advocates and programs. Sometimes picking out medications or takeout foods. There is a effort in France. They're reaching out to all the pharmacists, because that's one of the places that is open in addition to grocery stores. They're reaching out to pharmacists and helping them be ready when they're approached by a survivor. They have a code word, and they can link them to advocates and local programs. So again, this is a time where we need to be really creative in our communities to get the information out there about who we are and what we can do. Some might be able to go outside and do yard work, work in the garden, do things like that. But have that conversation with survivors about where they can find the time to reach out for help or leave or whatever their situation is. You might want to share with them some tips on emotional safety. What are some things that they can do to take care of themselves? What parts of their social network or spiritual support systems do they still have access to? What can they do if they're feeling anxious or stressed or overwhelmed or scared? And you know, the reality is that a lot of people, I think Anna said this on the call last week, that, you know, we want to get the message across to folks that do what they need to do to survive, do what they need to do to be safe in their situation, because they know their partners and their situation better than anyone. And just that overall general encouragement. And they might need to call you every day. They might need to call you every other day. They might need to call you weekly during this process. So figure out how you can be available and support them during this time. Are there any things on this? We'll go back to the chat box. Are there any things on this that thank you very much for sharing that, Lindsay. We'll send it out to you. Yeah, we're going to send that out to everyone and send it out again, and send it out again, and send it out again. So everybody's got it. So is there anything on here on this guide that we just reviewed that you've tried or give you an idea on what you can do in your communities? Lucy's got her audio back. Good. Anything that once you get off this call you want to focus on and get up and running? Let me think about that for a minute. And certainly, you know, keep in mind our helpline advocates are there to collaborate with you on some of the cases. We have not discussed the law enforcement response during this time, but Crystal, that's a good point. Reach out to your local law enforcement agencies. Okay, it says Crystal, hi memory. But reach out to your local law enforcement agencies. Just know ahead of time if they've changed their response to domestic violence, so you have that information in your hip pocket. We've heard of some communities that are changing their response. We've heard of other communities that are stepping up their response because they recognize this isolation dynamic might increase some of the cases. But whatever law enforcement is in your area, elevated level of discretion, which calls they respond to. Okay, so yeah, that's important information to keep in mind. So you've checked with Sheriff's Office and Phoenix PD. That's good information to share, memory. So again, reach out to law enforcement agencies in your area. Tell them who you are. Tell them your concerns about survivors. Ask how they're responding to domestic violence calls, so you know what role they can or will not play in some of these cases. That's just a good piece of information for us to have. And validating that emotional support has been the hardest thing. They're going to be isolated, and it's going to be desperate times for a lot of people. Yeah, so some perpetrators being let out of jail. You might get that call right after somebody has been arrested or detained. We know some law enforcement agencies do have advocates that respond or that they connect to, but we need to know how things have changed so we can give good information to victims. So do that little bit of research and outreach to law enforcement agencies so we're aware. So it's a disturbing trend that begets the question, how badly do they need to be hurt for law enforcement to respond? How badly do they need to hurt their partners for the perpetrators to be held in jail? Those are good questions to ask law enforcement, but ask it in as diplomatic a way as you can, because this is a different situation, so there's going to be different responses. There's a grounding toolkit. Thank you very much, Lindsay, for putting that up there. We appreciate that. You can access the information in the chat by those links, and we're gonna do some overkill and send it out too. So you can refer to it or print it off at your leisure, share with your coworkers who might not be on the call. We need to stay informed. We need to have as much information as is available. We've been trying to do our best to get this information out to you all. I think a lot of us have kind of felt frozen on what do we do, because this is so different. It truly has changed the way that we do our work. And then some of us have been able to do the research and make the phone calls and read all the emails and visit all the websites across the country so we can pull out some good information for you. You send an email, we're still here to Somerton Police and Least Police, and we did get a referral. I'll reach out since it's been harder. Good. We'll keep on, Gabriella. You know we will. Let's take a minute to look at the creative outreach. And Lindsay, if I don't know if we can hear you, but do you want to talk through this, or do you want us to?
Yeah, we can do it together, if that makes sense.
Okay, cool.
Yeah. And I know Lachey and Victoria are also on the call, so Lachey and Victoria, feel free to jump in too, if you have anything to add. Yeah. So we created this toolkit because we know, you know, there are survivors that we still want to provide services to, and this is really targeted to survivors that we aren't already working with, and so that's kind of what this toolkit is focusing on. So this first part talks about really like how to get the word out and how important it is to keep it simple when we're talking about flyers or shoe cards, really getting down to the basics of who you are as an organization, what you can provide, how you are maybe doing your services a little bit differently because of COVID-19, anything you want them to know. So maybe they you know, see your flyer at the grocery store, they don't have, you know, they don't reach out to you, but they see a supportive statement that says, we're here for you, we believe you, you know, that can be really helpful for survivors. Putting on there your helpline. I also think just a little bit more about the helpline and hotline information is during this time, especially for sexual assault survivors, you know, I don't want us to forget that active listening is a service that we're providing. And I know it, you know, it can be difficult because sometimes it feels like that's all we can do right now, or in general for when we're working with survivors of sexual assault, but that's a really important service that we're providing. So I don't want that to be diminished at all, because it's really important. Letting folks know, you know, I think in general, it's best practice to not have you know, a certain amount of time that you can spend with someone on the phone. It should be however long they need. So maybe they're having a rough time, you know, coping with anxiety, or maybe they're quarantining with their parents and their grandparents, and it was their grandparents that sexually abused them as a child, right? So they might just need someone to talk to, and that's why we're here, right? That's a purpose of the helpline and hotlines, is to be that you know, provide that active listening and emotional validation and support, and breathing exercises and grounding exercises. So again, I don't want to diminish that because it's really important. Of course, let them know that you're still providing community support and any donations that you all might need. There's also some links on here that if you haven't seen already, tips about how to get your message out. We also did Victoria created a sample flyer and a tear-off flyer that you all can use. I believe it's in a Word document. If you all haven't made a flyer already, feel free to use that one and let us know if you need help editing it. We're more than happy to put your logo on there and then send it back to you with all the information that's relevant to your program. Okay, Lashayre, Victoria, do you want to talk about newspapers, radio, and TV stations?
Sure. When we were putting this flyer or this toolkit together, we were like, what are some of the ways that we can do outreach that aren't person to person, right? I know a lot of us are used to building relationships with people, connecting with people, and that's how we've been able to get the word out throughout the years. But the newspapers and radio stations and TV stations, they're still making content and having advertisements. And that is something people are using when they're stuck inside their homes. And so there's a couple of different ways that we suggested you can use these. So you can pay for advertisements. I think oftentimes advertisements are more cost effective than we think they are. And so we can pay for advertisements in the newspaper, on radios, all of that. You could write a letter to the editor. And we have a link for a sample letter to the editor. It's not a COVID-19 specific sample. It's just generally like if you've never written a letter to the editor before, there's a sample that Doreen is showing or Ruby's showing. Can't see who's operating the computer. You could provide an interview, right? There's different news, like local news is always reaching out and interested in like how COVID-19 is affecting services and what those changes are looking like. And so they might be very interested in interviewing someone at your agency to find out what's going on. And then in this time, these local news sources are also looking for hopeful and positive news to kind of balance out all of the terrible things that are happening. And so I know we do have positive stories as well as some of the negative stories. And so that could be another creative way to get the word out. When it comes to the Postal Service, like, you know, when you get tons of stuff in the mail, right? Like lots of stuff that you might consider junk mail. And when we were putting this together, we were like, you know who might consider junk mail? Perpetrators. They might not look at some of the flyers and brochures and stuff that are in the mail. The victims and survivors may be the ones getting the mail, so it could be a really easy way to access people. And so sending out mass mailings about your services could be a good way to get the word out. Like I know since COVID-19 started, I've gotten like 5 different mails from food banks because food banks have been hit pretty hard with donations and even finding food. So, and I've gotten a ton of mail from them. And so that's a really good way to get things out. If you're in a small rural community, this might be even easier to do. Right, in the larger, more urban communities, it might be difficult to be like, which area should we target, all of that. That could be a bit of a challenge and it could be expensive. But in the smaller communities, it might be very feasible. And you can strategize with your postmaster. There's different things you could send out. You could send out flyers, postcards, letters, door hangers. And you could send it out to individual households. You could send it to services that are still open and businesses that are still open, because I think everyone's just thirsty for information and wants to receive this information. We also talked about different communities have been strategizing on like what's the safest way to get this information out. So on this kind of information that's just going to like every household potentially, maybe putting on a bunch of different social services contact information, right? Because then it might not be super obvious, to perpetrators that it's domestic or sexual violence information, right? So they might be less likely to throw it out, or they might be less likely to pay attention to it. Lachey, did you want to talk about this at all? I've been hogging the mic.
No, you're fine. I think I can start on the next page if that works for you.
So we talked about calling your partners, right? We know that a lot of the core of our outreach is all about our community partnerships and our relationships with our partners. And so keeping in touch with those partners, even though we can't meet face to face, we can call them, we can reach out, let them know, let individuals that we work with really frequently know that we're open, let them know the changes that you've been experiencing to get the word out. And you could even start trying to build new relationships, right? Like you could reach out to different community leaders or spiritual leaders in your community that maybe you haven't talked to before, and just like talk to them about what's going on. And you could build relationships like over video chat or over the phone. And that could be a really cool way to get the word out.
So let me jump in here, Victoria. The faith-based leaders may be able to contact a certain swath of your communities. My mom has been talking about how her pastor has been dropping off Bible readings on her front step, or calling the congregation, each member of the congregation once a week to, read a certain passages in the Bible. So talking to your faith leaders about how they can be of help would be a really good idea in some communities.
Okay, so I'm sure we all have a lot of experience with making flyers, but especially during this time, like Victoria said before, going to some of those places that are still where people are gathering, even if it's for about 30 minutes, could still be useful for us. And shoe cards are also really useful, because even if someone doesn't have room to carry around a big piece of paper, they can easily slip a shoe card into their shoe or into their pocket. So this might be another way to get our resources out there. And I think specifically, we talked about earlier, maybe collaborating with some of your other partners, so that maybe if you even make a flyer, it's not just your information on there, it's a lot of different resources. So those who are causing harm might not be as suspicious of just seeing a domestic or sexual violence program on these resources. So that's just something to consider. And it also helps with that community collaboration piece, because you are able to get all of your resources out there, and it's a mutual relationship. And again, reaching out to local business owners or people who own grocery stores or pharmacies would really help. And so also on this page, we listed a bunch of different places that are still considered essential. Thanks, whoever's operating the computer. A bunch of essential services that are still operating during this time. And another tip might just be, we all know that we're trying to limit maybe some of the news that we're hearing about COVID-19, but it also might be helpful to just keep track of what the essential services are, because those might still be potential resources that you can reach out to. So becoming a resource drop-off zone. So I know for a lot of your programs that you already do this for survivors. So once they are maybe no longer in your residential services, or they're just a part of your community programs, you have spaces where they can come pick up resources. But maybe during this time, you can open this up to the community. So we called it a resource drop-off zone, which is essentially a place where people can come to collect some of these basic things that they might need, like toilet paper. We know that a lot of people, because people are stockpiling, there is an abundance of it. So maybe you all could set yourself up as a resource zone, maybe at your main office or some other public place, and then have a time to distribute those out, or even have a time where people can just come pick them up themselves. Whatever works best for you all, just to make sure that even if people aren't able to access your services, they can still get what they need immediately to stay safe.
And just to jump in, something I read over the weekend is that, so we have a toilet paper shortage, right? for residential toilet paper, but the toilet paper distribution hasn't changed. And so a lot of businesses that are currently closed or all the employees are working from home, they're still receiving their regular shipments of toilet paper. So that's like another connection. Like you could reach out to some of the businesses that maybe have either closed temporarily or have sent their employees to work from home and reach out to see if they have an abundance of toilet paper that they might be willing to donate to you all during this time. Because that could be a really good way to get that toilet paper.
Thanks, V. Okay. So virtual and internet-based outreach. So when we think of a lot of internet-based outreach, we think immediately for social media, but there's other ways that we can still reach out virtually. So ads, especially on Google, or just even when you're surfing the internet, are another way to get your services out there. And like Victoria said before, we really don't want to underestimate the power of advertisements. We see ads on TV all the time. Even if you have like Hulu or something like that, you still see ads. So it might be important for us to still utilize that, that form of outreach. And so again, we want to highlight our services that might have changed during this time, but also to emphasize that we're still there to provide support for survivors.
And then one of the great things about internet outreach is that when we make flyers or we send out mailings or anything like that, we might be more limited financially in how many things we can produce and create. Like how many flyers can we afford to print? And they might all need to look the same. But with social media and internet outreach, we can do as many things as we want for free, essentially, right? We just have to have the time to create them. And so that could be a really good way to like advertise your services, yes, but also like advertise self-care and healing practices and different strategies for coping with isolation during COVID-19 and different safety planning strategies, like in short little social media posts on Facebook or Instagram. And so we do have a ton of tips here of how to really maximize your social media. Because we know some folks are super familiar with social media, some folks aren't, and that's okay. So we just have a few ideas of where to start. Like I think Instagram, Facebook, and Twitter are some of kind of like your essential core social media. But some really good ways to do outreach are those neighborhood groups and those neighborhood apps, because anyone can post in them, and they're really targeted to specific communities and specific geographic areas. So that's a really cool way to reach people.
I just want to highlight that, especially for social media, when we're trying to reach out to youth and for those who are younger, I saw a news article of the other day that more youth are on TikTok now than are on Facebook. So we just also have to, you know, again, something else that you all might not be familiar with, but that's what we're here for, and we can provide technical assistance even when it comes to utilizing social media to advertise your services. So just, we're here for you.
Yeah.
Okay, let me jump in for a second. This might be a time too between, you know, us as staff in our programs, our directors, that we brainstorm on how we can mobilize our boards and how our boards of directors can get involved. Some of them are business owners, some of them are professionals in other careers, but they may well have a long outreach in our communities and can help us get some of this information out, or even pay for advertising out of their own pockets. So it's also a way to mobilize our boards and our donor bases for our programs to get involved in some of this. Some of it we might be able to talk to our funders about on how different ways we can use our funding during this time. So that's really important to explore those avenues when we're changing the way we do outreach.
Yeah, and one suggestion too with just creating posts for social media, we have several suggestions on like colors and all of that, but so we used, and we've actually gotten questions on how we created these toolkits. We use Canva. It's like a fairly easy to use like graphic design website, and there's actually a free a free version as well as 2 different levels of paid versions. And the free version has a ton of useful things. Like I use a free version for like my dog's Instagram, for example. And I have no trouble with it. And so that's like a really accessible tool that you all can use to create really attention grabbing content, right? And we used Canva to create all of these toolkits that are kind of like, the goal would be to be like very attention grabbing and like visually pleasing. You can also use your email list that you already have to email out updates about your services. This will, of course, primarily reach people that you've already done outreach to or potentially already served. And that's still a good thing and still important outreach to do because people are getting triggered during this time, right? And they may reach out for services again, but they might not be aware that you're open. And so we have a link here for a template. It's on the second page of this PDF. There's a template for just like a letter or an email of like how to send out the word that you're still open in like an email form. And so it's kind of like fill in the blank for that. And then you could also host virtual meetings and events. So I know one of the ways that we do outreach is we do presentations for the community and for different organizations. So you can still do those presentations. You'll need to do outreach around those presentations, of course, to get people to attend, but you can still have virtual meetings and events for the community during this time just on the internet, like using Zoom like we've been doing right now. We did link to some safety tips about this because as people have been using Zoom to have different meetings, there have been people who are getting a hold of the link and then saying like hateful things in the comments or interrupting. And so it is important to keep in mind all the tech safety that you'll need to do around this. But there are different precautions you can take to limit. Like my friends actually, they run like a club night for queer women, and they did a virtual club night, and their event like link, some not so nice people got a hold of it and were harassing the people who attended the virtual club night. And so they solved that problem by having it like a secret link. And so to attend the event, people had to email them for the link, and I don't think they've had a problem since. And I think that's it.
Okay. Let's go back to spend a few more minutes on safety planning, then we'll open it up for some questions or comments. One of the conversations that we need to have with survivors when they get to us is about language that they might use on medical visits or when they interact with people, especially if their partner's with them. You know, when they have an opportunity to meet with a healthcare professional, for instance, and they might be coughing, but it hasn't got anything to do with COVID-19. It's about maybe having been strangled by their partner. So making that clear and being able to get that information across to your healthcare professional. We know that some abusers, when they go to appointments with their partner, they stick right with them like Velcro. So being able to relay what's going on to the healthcare professional is really important. I know we've done a lot of training around the state, and the Rural Healthcare Network advocates have been involved in their clinics on alerting the healthcare professionals about screening for domestic or sexual violence. This is an opportunity, especially for those of you in the clinic, to put the healthcare professionals on alert, knowing that that might be one of the only places that survivors can get to. So having that conversation with healthcare professionals in your community, again, making sure we're aware of any changes in police response. We know that, like Memory shared, that people are being released from jail and prison. I was under the impression it was just supposed to be nonviolent offenses, people that perpetrated nonviolent offenses that were being released. But that's another good thing to know on what's going on in your area. It doesn't seem like it's a consistent response. It depends on what community you're in. So it's a question from Sarah. Jail release, have you seen instances where abusers are being let out early due to social distancing? I would venture to, I haven't heard of any instances, but I will guarantee you where under normal circumstances, somebody might have been detained or arrested and held overnight. That may not be happening. So again, that's another phone call that we need to make and information that we need to have so we can factor that into our safety planning discussions. We know that there has been a increase in people buying guns and ammunition for some damn reason. I don't know. I don't know how you can fight COVID-19 with a gun, but obviously some people think that they need to. So just keep that in mind. There may be an increased presence of firearms in some survivors' lives. So that's a question that you want to ask. So you're aware of that. So other information to share. Thank you very much, Lindsay. Cool tools to cope with anxiety around COVID-19 is a link that she shared. Virusanxiety.com. Oh my God. And then Canva's the program that Victoria was talking about, the tools that we use to create these guidelines and other safety considerations. So let's open it up for any comments or questions or clarifications that you all might need, or any other areas that you might need support or information, and we will try our darndest to assist you in those areas. So either questions or clarifications or some ideas that you have on what you're going to do after this meeting in your communities. If your creative juices are flowing, type that in there. It might give other folks some ideas around the state. We've got pretty good statewide representation on this call. So what do you got? What's happening? What are you coming up with? Or are you still thinking? Or is that too much information too fast? Okay, we'll give you a minute to think. All right, take a coffee. It is a challenging time. Yep, think outside the box. Yeah, and again, Gabriella, focus on those places where people are still able to go, where survivors might still be able to go, and do that collaboration with them, like Victoria talked about and Lachey talked about. Give them, and you might need to come up with a list of ideas. And you know, however many advocates you have, come up with a list of ideas, and everybody take a few of those ideas and move forward with it. So mobile advocates been doing your best problem solving around continuing to meet the needs, I know, and just keep on keeping on, Memory. We're gonna learn some stuff out of this. We're gonna discover new ways to do services. We're gonna discover new ways to support people and keep them safe. Give yourselves downtime and those times to be frozen and confused, because that's a normal response to all this. We're gonna, Cassandra, we're gonna send this out again. There are links in the chat box. We're gonna send this out to everybody who's on the call. So you'll have it in your hands. The Creative Outreach, the Advocate's Guide to Safety Planning, and then the self-care one that we're going to review here. So maybe brainstorm, Gabriella, on a list of what you can do in the community, or who you can reach out to in the community, and then assign each person a couple of those to see how far they can get or who they can get information out to. And if your grocery store guy is approached or gal is approached by a survivor, how they can link them to your services and support. But let's talk about us for a minute. We gotta talk about us. Our work is hard, and it's even harder during this time. So we've really gotta take care of ourselves. So let's look at self-care. Self-care. Yeah. Lindsay, you want to talk about this?
Yeah, I could start. Before we start that, Victoria, do you want to mention, I know Victoria had an idea that we want to see if folks will find it useful. So Victoria.
Yeah, so I just wanted to ask if everyone was interested in potentially having another conversation like this that was specifically about providing emotional support during this time, because it seemed like it came up in the comments that was a really big challenge folks were facing. And so we could have another conversation like this that's like specifically like how to provide that emotional support and active listening over the phone or over a video call or over text. And so if folks are interested in that, we could set something up pretty quickly for that.
Yeah, thanks, Victoria. Let us know in the chat box if that's something you're interested in. If we get a few folks that say, you know, it would be helpful, then we can definitely look into putting that together. So yeah, so we made this toolkit about self-care. Started with the Brene Brown quote. You can go down, Ruby. So we are really framing this. We started it off as a toolkit. It turned into more of an activity book. And so this can be for you all. This can be for survivors you work with. You can send this to your friends and family, right? This is really for folks, everyone to use during this time. So we want to start by saying, you know, whatever you're feeling is valid. This is an experience really unlike any other for some folks that, you know, aren't used to working from home or, you know, feel even more isolated. So it's okay to feel those things, and we really want folks to know that right off the bat. One thing that we can do for ourselves is showing ourselves compassion and kindness. You know, I think we treat others better than we treat ourselves oftentimes. And so we wanted to put an exercise in here on self-compassion to really appreciate ourselves and be kind to ourselves. Because if we're not, you know, in that space, then we're not going to be able to provide the best services that we can. So it's important to show ourselves those things. All right, establish a rockin' routine. So practicing social distancing, right, can throw off the way we usually do things. Establishing a daily routine can help create predictability, which is really important for a lot of folks, especially survivors. A sense of control, and overall improve your mental health, right? That emotional well-being piece. So we had some ideas to kind of start jogging folks's ideas for what might work for them. So maybe starting every day with the same activity, right? So maybe a 15-minute walk, making your bed, maybe meditating for 10 minutes right before you start work. Maybe that's drinking coffee on your patio, right? If you have a patio before you go to work. Maybe that is, I heard of folks driving around the block and then coming back into their home like they were doing that commute. Have a bedtime. It's important that we get sleep. And maybe plan regular times to do those things like going to the grocery store, checking your mail, or running those necessary errands. So routines are really important during this time. And anyone feel free to jump in too. Feel free to write in the chat box. And then Victoria, Lachey, Doreen, or Sam and Ruby, feel free to jump in. So we know that connection is so important. We are humans, and you know, a lot of us at the end of the day thrive on connecting with each other. And so, you know, we have this activity list, 3 people who you can call, text, video chat, or write this week. And maybe that's writing a letter. Like, I can't remember the last time I wrote a letter. It was probably to my grandparents when I was a kid, right? So it could be something that you want to take up again, but an activity that you could do. Tips on staying connected, right? So we've had a lot of folks start doing regular Zoom meetings. A friend said yesterday that he does Zoom meetings with his family every Sunday. Maybe you're, you know, eating dinner together or eating lunch together. That can really help strengthen our relationships and have more of that face-to-face time that some of us are used to having. Scheduling times for those folks that might be more shy. Let's check in on those folks that might be more introverts. There are apps like, I've tried to download House Party, but I haven't done it, haven't engaged in it yet, but House Party or Game Pigeon that can be used to play games with coworkers or friends or family. Yeah, we're gonna get through this together, right? We're all doing a good job anyway. We're engaging in those positive social interactions, like being on this webinar today, right? Self-compassion check-in, making sure we're being kind to ourselves. So here's another exercise that we can do. All right, it's important that we don't forget to breathe, right? I think doing regular breathing exercises, research has shown that it really just increases your mood, and it just overall improves your mental and physical health. And so I think it's important that that we remember to do that during this time. So we have an exercise on here. So inhaling for 4 seconds, right? Like kind of blowing yourself up like a balloon, so your stomach and chest should extend. Holding it for a few seconds, and then exhaling for longer than you inhaled, right? So we made suggestions to inhale for 4 seconds, hold for 4 seconds, and then exhale for 6 seconds. But this could take time, so remember to be kind to yourself. Some apps that you can download on your phone that are guided breathing and meditations. So a lot of those are really great resources. All right. Does anyone else, Lachey or Victoria, want to talk about limit information intake and keep your mind occupied?
Yeah, I can do that.
Yeah.
So we know that about every hour or even every couple of minutes, we're getting new updates about COVID-19. So it might be important for us to intentionally take time away to limit the amount of information that we're receiving, because it can be very overwhelming and even increase our anxiety when we're getting new updates and we're unsure of what's going to happen from 1 hour to the next. So we have a couple tips about that, and I apologize everyone, my fire alarm is going off, so that's that chirping that you hear in the background. But back to what I was talking about. So we can do some mindful things like putting our phone on Do Not Disturb. I know for me, when I first started out, that was very, very like anxiety inducing for me in itself. But once I started practicing just doing it for like an hour, I realized how much less stressed I was with not having to worry about it and being able to complete tasks. And just be able to focus on that task instead of worrying about 3 to 4 things at one time. Even cleansing ourselves from social media, because we know a lot of it is also related to what's going on with COVID-19. So maybe even deleting some of these apps for maybe a day or maybe even 2 days, and just seeing the differences that you feel in your mood or and your stress levels, and just observing those. And then also setting a bedtime is like one of the best things that I've done. So like instead of just staying up all night because I have all this energy because I'm not moving as much, if I go to bed at 9:30 and then I get up around 7:30, then I feel more connected and more in that routine. So I feel a little bit more regulated throughout my life. And then we can also try to, even if we're still engaging with social media, because that's a way that we stay connected with others, we can try filtering off some words or phrases. So you can, for instance, for on Twitter, you can mute certain words. So I would mute phrases like COVID or coronavirus or virus, and then I won't see any of those tweets on my timeline. So then I can avoid seeing those for as long as I want to, and I can add those words back in when I feel it's appropriate. And so not only do we want to keep our bodies busy by engaging in some type of physical activity, we also want to keep our minds occupied. So that might mean doing some errands around your house or taking care of some housework, or that might also be doing some things for pleasure, like doing a puzzle, engaging in some humanitarian things. So like Victoria, this weekend spent time making face masks, and that was helpful, but then it also kept her mind busy, I'm sure. Or you can do some things like reading. Like this might be the perfect time to catch up on a book that you've been wanting to read or haven't had the chance to. Now might be a great time to mix up your routine a little bit and enhance your personal self. Okay, V, do you want to take this one?
So one thing that can be really helpful during this time is continuing to take care of our bodies and minds. I think when we're stuck indoors, like indefinitely, it can be really hard to like get that kind of physical movement that we all need. And we know that sometimes for those who have experienced trauma, and then COVID-19 is a trauma in and of itself, moving our bodies can actually be really helpful for releasing some of that in our bodies. And so we have a few suggestions here of like ways we can take care of our bodies and minds. So continuing to eat healthy foods that are high in nutrients and vitamins, making sure we're getting enough water, reducing caffeine or alcohol. Some fun things that we can do are like finding an obscure item in your pantry. Like maybe you have like a random jar of some pepper that you've never used before, but you bought this like can of peppers and you want to try something with it. So you could look up a recipe with that, and then you're trying something new. So you're trying a new recipe, which is stimulating your mind, and trying new food, which is stimulating your body. You can take a relaxing bath or try a soothing scent. Sometimes those kind of sensory things are really helpful for folks. You could learn a hands-on skill or craft. Those masks are actually, if you're interested in learning how to sew on a sewing machine, those masks are super beginner friendly. They're pretty easy to make. So that could be a new way to learn a new skill. I've seen lots of people learning how to play new instruments, right? Like if you have a guitar and you've never had the time to learn, you could take lessons through a video with different folks. Like there's, I think, a bunch of different creative ways that people are offering lessons for new hobbies. You can play brain games like Sudoku. My problem is I tend to get addicted to these, so I'll spend like 5 hours playing like a brain game on my phone. So that's not a good thing for me to do, but it can be helpful in small doses. And then you can also connect with therapists. A lot of therapists are currently offering virtual options, and then there's other organizations that have always offered virtual therapy. And so we have down at the bottom, list one thing you can do to care for your mind and one thing you can do to care for your body during this time. And then moving your body, another way to care for your body. Staying active, going for walks can all be super helpful. There's lots of workout videos on YouTube that you can follow and other online sources. I think it was Krista. So shout out to Krista if she's listening. I think she said her gym was offering virtual, maybe, actually now I'm thinking it wasn't Krista, but someone's gym was offering virtual classes. I can't remember who. I've seen a lot of people riding their bikes lately. Oh, it was Anna. It was Anna who's doing that from Catholic Charities. And, but I've seen a lot of people riding their bikes around, people doing gardening if you have a yard, or you could do some indoor gardening. I have adopted some of the office plants during this time. So I've been doing a little bit of indoor gardening. I also have some like starter plants from the office because I went in like 2 weeks ago now and was like doing the plant care because that's one of the things I like to do at the office. And I trimmed off some of the like baby plants. And so now I have 5 baby plants that we'll see if all 5 make it. I had 6, so not doing so well, but I like doing it. You can watch some dance instructional videos, learn move. You could start yoga. And I like this a lot because I find in-person yoga to be extremely stressful. I don't like other people looking at me attempt to do yoga. And so you can actually try to do yoga from the comfort of your own home and nobody can watch you. So I actually really like that. And the Trauma Sensitive Yoga organization is actually offering free trauma sensitive yoga online during COVID-19. And at first they had 2 weeks of lessons and now they have lessons through the end of April, and they have lessons in English and Spanish. And I think they were trying to see if they could add more languages as well. And they have different levels. They have chair yoga. So if you're not able or you don't want to do like full kind of yoga, you can do it in your chair. They have fast yoga, slow yoga, all different kinds of thing. And I feel like it's a very low pressure version that I really like myself. And then of course, you can have sex. The healthiest way during COVID-19 is with yourself, right? So masturbation is a great way to explore your sexuality during this time. So that's cool too. You can do different things to express yourself. So you can start new artistic hobbies or get back into one that you've done before. You could do a DIY project, right? I'm a big fan of doing DIY projects. You could sing your favorite song. I know people can do virtual karaoke. There's different YouTube videos of like karaoke versions that you can all do. You can try a new recipe or experiment and create a new recipe. I know people have been doing lots of baking and cooking during this time. You can write, draw, paint, any kind of artistic expression that you want to do. You could also start a journal, right? You could document how it's going for you. You could record your whole day. You could just record your feelings. It's really up to you, however you want to start a journal. You can draw in the workbook if you want to. And then so here at the end, we just have a bit of space for you to create your own self-care plan and to brainstorm a little bit. We know it's really important, self-care. It's the way we take our power back. And so we might be feeling more powerless in this time just because we don't have control over COVID-19. And there's a lot of unknowns, right? And we don't know how this is going to affect everyone. And so doing some self-care can help you feel a little more safe and secure yourselves, as well as the survivors you're working with.
Okay, so we're going to make sure to send all of this information out to you. Again, the self-care, the creative outreach, the safety planning. We hope to give you some ideas and enhance the work that you're doing, support the work that you're doing. I know, like it has been said a couple times, Victoria just said it, this is going to impact all of us differently. You might just want to be in your bed with the covers over your head. I mean, you know, don't pressure yourself to do things that you're not ready for, but if one of those suggestions on the self-care thing sparked your interest or you think you can do it, because if we're going to care for others, we do have to take care of ourselves. And some of us just may be able to do the basics, you know, staying hydrated, eating something, getting some sleep. But be gentle with yourselves. The biggest thing is be gentle with yourselves. Give yourself some grace. Know that you're not alone in this, that we're here for you. And we will continue on with your feedback and sharing your needs with us. We'll try our best to help you and support you.